So today we're going to hear how AI can seamlessly be integrated into pediatric workflows, how to explain the findings to parents in real time, build trust through visual communication, and create a smoother, more efficient experience for your whole team. And we're proud to be partnering with Pearl today for this webinar. And I'm thrilled to introduce our panelists for the webinar. So I'm going to introduce Sheila first. Sheila is our co-host from Pearl, and she is a practice leader specializing in clinical operations, team development, and practice growth. She previously served as Chief Operating Officer of a high-performing private dental practice, leading a team of over 50 team members and supporting more than 13,000 active patients. And she continues to serve as an advisor. Sheila is the head of clinical education at Pearl and former director of clinical operations, where she leads initiatives focused on practice transformation, clinical performance, and the adoption of dental AI. Known for her practical, results-driven approach, she helps practices improve efficiency, strengthen team alignment, and evaluate the patient experience. She is also the founder of Absolute Dental Business Solutions and a graduate of Loma Linda University and a registered dental hygienist. So thank you so much, Sheila, for joining us today. And I'll let you do the next introduction.
Thank you, Erin. It's great to be here. And very excited about our partnership with Patterson and Eaglesoft. Delighted to always be able to make anything effortless in dentistry. So our integration is helpful for that, and we'll see that later today. This webinar I'm really excited about because it's actually kind of funny when you think about effortless and pediatrics, because they really don't go hand in hand. In some sense, it's fun and great, and it's my most favorite patient I ever work on. But effortless is really probably the exact opposite word that is really in alignment with pediatrics. So I'm really excited to have Dr. Solomon here today to show us how to really make it effortless, but also walking through such a high quality practice where they're serving multiple people throughout the day. And we know those little squirmy little guys aren't going to sit around. And the parents, right? When you tell somebody you have a cavity or something, we're all in shock the first time. So again, just a few teasers on how Dr. Solomon is going to really share with us how he's made this seamless, effortless, and really actually a fun place. So without further ado, let me introduce Dr. Solomon, our speaker today. He is a second-generation pediatric dentist who has been practicing in Livermore, California for over 20 years. He has earned his bachelor's in biological sciences and went to dental school at University of Pacific, and then completed his 2-year specialty residency and a master's, as if he needed to do more things at once, at the University of Texas. So in Houston. He is a diplomat of the American Board of Pediatric Dentistry and a fellow of the American College of Pediatric Dentistry. When he's not in practice, which I think is pretty much 7 a.m. to 7 p.m., I could be wrong, he is internationally recognized speaker and a clinical instructor. He's the owner and director of BioClear Pediatric Learning Center and the Dental Specialty Training Center. So we'd like to hear a little more about that. It's very exciting what you're doing in your what we call free time, right, Dr. Solomon?
Correct.
He will be working in those centers with pediatric information for even general dentists to focus on hands-on courses and such. So another wonderful gift by our wonderful prize speaker, Dr. Solomon. So thank you so much for taking the time to be here. We're honored to have you, and we'll turn it over to you.
Great. Thank you so much, Erin. Thank you so much, Sheila, for being here today. So I will hit share and I will pop over. So I'll let you guys get to know me here in a little bit. But as far as my relationship with Patterson, I've been an Eaglesoft customer since the first day I transitioned from paper charts to an electronic health record. So that was, I don't know, maybe 18 years ago. And even before I even knew about Pearl, and Pearl was in existence, I was a beta tester for Eaglesoft. So it's been a great project for me. We were actually, I believe, the first office in the country to integrate Pearl into EagleSoft. We help with a lot of the testing with that. And we'll talk about why in direct integration, if you can, it's not required, but it is advantageous just for the flow of your practice. So if people have questions today, please go ahead and enter them in. And then you'll have all my contact information when we're done. I try to be very reachable. So if there's something we didn't cover today, if you're a general dentist, if you're a pediatric specialist, if you have any questions about integrating all these things, please reach out to me. I do try to get back to everybody within 24 hours when I can. So thank you so much for being here. So the topic today is effortless AI in pediatric dentistry. And as a pediatric dentist, I actually think pediatric dentistry is effortless. I don't know how people treat adults all day. I mean, I have a lot of teens in my practice, but my hope is that all of you that treat children or teens or young adults in your practice, I want to make things easier for you. Dentistry has not gotten any easier, and Sheila can, I'm sure, attest to this. Post-COVID, our costs are higher, the patient demands are higher. People look up stuff themselves online and then come to the office and say, well, what about this? And I find if I, as a clinician and an educator, if I really bring in tech that I can integrate into my practice and use it as a communication method and a diagnostic tool, things get easier, right? I don't want to just bring in technology to have fancy things with lights and impress people with the stuff that I bought. I need to have everything I do part of my clinical diagnosis and my ability to communicate that to patients and parents. So we really have 4 takeaways today that we're going to discuss. We're going to talk about workflow. And that, I think, is the most apropos as far as talking about EagleSoft and Pearl together, because in a pediatric practice, we see a fairly high volume of patients, and I need everything just to mesh. I need to be able to not have technology slow me down. If anything, I want it to speed me up. So we're going to talk about how we integrate this technology into our workflow for every single patient, every single minute of the day without getting stressed out, having to go turn things on and open programs. We're going to talk really about conversations with our patients and parents and how to increase our ability to communicate, because I spent a lot of years just even on a light box bringing the x-ray up and showing parents on the light box and pointing out, well, do you see that thing? And they would say, yes. They didn't see any of that, right? And I need to have those tools not only to help me diagnose, but to communicate. And really, a parent of any ability of understanding, they don't need to have a medical background or dental background to really understand I'm not just making things up. There really is a decay process in this tooth, and I'm just trying to help your child. But if they don't buy into that, and I don't have that communication ability with a parent, things don't work out at the end of the day. And that really gets down to trust. I find I have a very high acceptance rate of treatment in my practice, and I believe that comes down to trust. If parents and patients and the grandparents, whomever brings that child in, if they trust I'm going to do the right thing for their child, then yes, that first conversation may be a little bit more difficult, but then the second and third and fourth and fifth, then they know I'm not out just to have billable services. I really care about their child, and I really want the best for them. I'm not trying to just pad my pocketbooks. I'm doing things in order to help their child's oral health. And then we want to talk about the patient experience, right? Because of the fact it's gotten more competitive to be a dentist, right? Every day offices open and, large groups may come in. And at the end of the day, I am running a business, right? Yes, my clinical competency, my ability to treat patients, my trust with those parents, those are all important. But if I don't have a business to work in at the end of the day, none of those things are going to be available to me, right? So just quickly about me, I am second generation pediatric dentist. I took over the practice for my father about 23 years ago. 2.5 years ago, moved into a much bigger facility. So we have 6,000 square feet and 13 ops. And integrated, I have a teaching center there. My email address is right there, joshua@pediatricdds.com. If you're trying to find course information or also contact me, you can go to pediatricdds.com as well. And on the upper right, there's a QR code if you want it just to get all my information. And I am on Facebook quite a bit. So I post all of my courses. anything like this that I'm doing. So if you want to friend me on Facebook, you can always have updates on anything that I'm teaching. So just a little view of my office. I mentioned we're in about 6,000 square feet. I'm currently sitting right about here. And I wanted to have an office that was open and bright. I didn't want to have a little kiddie theme office. I really wanted to be available to all ages, because I do treat some adults once in a while. I treated an 80-year-old prosthodontist friend of mine not that long ago. I mean, I don't do that very often, but I wanted to have my facility to be comfortable for everybody. And just a few pictures of my office. Again, we try to keep everything light and bright and open. Gone are the days that we learned in COVID that you can't push everything together and have everyone sitting 2 feet apart. It doesn't work like that. So I needed enough space and a facility that I'm proud of and that we can bring in, all of our patients and everyone's comfortable. I wanted to give one little gift to everybody that's on this webinar. This is a QR code of all my parent and patient handouts, all my instructions. So 20 years of making handouts. I've made this available to everybody. So you have my permission to take my logo off and put your own logo on. Over-retained baby teeth, that one gets downloaded quite a bit, but we have a lot of handouts available. Actually, I should have handouts on Pearl and some things for Patterson on here. That would remind me. Aaron, you'll have to remind me to put all my custom draw types and things on here. I will do that. But if you want handouts for your patients, this is available to you. It's free. You don't have to register. Just hop on and you can take anything you want. So let's talk about this first key takeaway, seamless workflow. How do I integrate not just AI, but technology into my workflow on a daily basis and improve my quality of care and make my life easier, make my team's lives easier? We all know, if you've been in practice for a while, I'm sure Sheila, when you first saw the first laser that came out or the first intraoral camera, you needed to warm up for 5 minutes and you had to bring it in. And the question is, did it really speed up the process of our dental care? Because yes, I would love to spend all day with one person. That's not going to happen, especially, in the hygiene world. There's more and more pressure to speed up appointments and deliver quality care at the same time. And that's not always easy to do. So anything that I integrate into my practice, it needs to be seamless and fast and efficient, right? So we're going to talk about these 4 S's: systems, staff, supervision, and speed. And speed really is efficiency. I don't like to use that term, but it was an S word. I want to be efficient when I do. I don't want to rush. I don't want to have a practice where my hand's on the door and parents think I'm rushing, but I want to be efficient in what I do. And it was an S, so it worked out perfectly. So this is kind of an average day in my practice, right? So I'm not a large group where we have 17 providers. This is just 2 pediatric dentists that are working. And we have 1 assistant per column, and typically 1 or 2 floater assistants, and then a treatment coordinator is helping to run that day. And we spend a lot of time with parents. I do not feel like I rush. We run on time, but we have buffers and things built into our schedule so we can work efficiently and proficiently throughout the day. So I'm going to give you just some pearls here, no pun intended, I guess a little pun intended, on just some things not having to do with AI or treatment planning, but just some of the things that I've learned to do over the last 20 years to increase that efficiency in your schedule. Actually, one of my team members came up with this, is because I was always wondering, do parents want to come back? Do they not? Well, it turns out there's a lot of parents that would love just to have 15 minutes on Facebook or on their phone and check their email without hearing mommy, mommy, daddy, daddy every 15 minutes. So actually, there's a fair amount of parents that want to, stay in the reception area. So we ask every single parent or caregiver or dads or moms, whoever comes to the appointment, at the fair, do you want to come back with your child right away? Do you want to come back during the exam? Or would you just like an update at the end? And what I found is that parents feel like they're listened to. We're not separating them from their child. Gone are the days like when my dad was working where the patient just came back by themselves and the parents wait in the waiting room. It's completely up to them. We do mark our charts to know when a parent came back, if a doctor spoke to that parent, because at least every other visit, I want one of our docs speaking to that parent. And but unless the doctor specifically wants, and in the team huddle, there may be parents that I want to talk to. So unless the doctor specifically wants that parent back, the team member will have that parent back if they notice a concern. So if mom or dad or grandma's in the waiting room, my team automatically knows that if they see something, one of the key metrics, that we follow when we want a parent back, they will go ahead and get that parent. So I'm not waiting, or one of the associate doctors is not waiting. So what have we done to help increase our staff and our systems of supervision or speed? Number one, I think most people now have paperless medical history updates. So we require those before that parent or patient comes into the office. So we're not waiting like the old days for people to handwrite things. Happens once in a while. But also within EagleSoft, pretty slick, there's a lot of customization you can do in your chart. And so we have little alerts that pop up. So the second my front desk sees that schedule for the day, they automatically know who sent in their medical history and who did not. So they're not having to look through every single chart. That's a feature built into EagleSoft. Works very, very well. Before that appointment day, 1 or 2 days beforehand, either my office manager, my clinical lead goes through all the charts. They see who needs x-rays. We assign what patients are in what chairs. And then we discuss in the morning, that huddle, okay, we have this patient coming in, they're kind of loud, so we maybe should put them over here. Or this parent wants a little bit more privacy, let's put them in XYZ room. I find this helps tremendously as far as our flow, because if you're not organized, a schedule like this will eat you alive, right? And I want every parent, every child to have that experience that I'd want for my own kids. And you can only do that through having these systems in place. And then I know it's the CPAs sometimes don't like it with the amount of staff that I have, but I have one assistant per column. That assistant is assigned. Those are their patients. They know if they call in sick that day, someone else has taken their patients. They have to take responsibility for those patients. They're going to, along with the doctors, of course, look at the medical history, be prepared for that column. But then we also have a floater and a treatment coordinator. And then this is another big one. My team knows if they see something significant, decay, pathology, they're automatically hopping in, taking intraoral photos and getting that parent back. Little things like that can slow you down by 5-6 minutes. And you do that enough times during the day, it can really slow down the process of, your exams. And then we call them, one of my assistants came up with holers. That's a large hole in a molar. So if there is a hole, or if they see just all of a sudden a tooth that really needs, they think something going on, they're going to grab the camera out. They're going to bring the parent back. They're going to start that. Now, they're not diagnosing anything, but they're just starting that documentation. And they may buzz me or in the radio say, hey, Dr. Josh, do you want me to take a PA of this tooth? And I'm going to say, yes, absolutely, please do. And then specifically, as I mentioned, parents are brought back if in the reception area for certain things. And that ties us into our Pearl second opinion. So if they see things like this, they automatically know what to do. Now, they're not diagnosing, but my team has the ability of just seeing color. If they see a lot of pink and they see a lot of yellow, they automatically know what are the next things that I need to do. And we're going to talk about that today. And as important as the software that you use for your caries detection is integration when possible. Pearl can live in two worlds. It can live online, and Sheila, you'll correct me if I'm not describing this correctly. It can be a web-based portal, which works very quickly. You just open it, you see all your patients that day. I don't even know how they get it that fast, updated, uploaded online and the AI run, but it's almost seamless. And then my suggestion is for any of you that are going to bring in AI caries detection, if you can have it run within your software, it's always the most efficient. Now, online, there's more features, right? But for the vast majority of patients, what works well for me, it's in my EagleSoft. X-rays come up in EagleSoft and it's already there. They can toggle things on and off, but it's integrated into the software, and that's where the speed really comes. Again, if you're going to view it online, not a problem, but it is faster if it's integrated within the software. I want to give everyone just really quickly to go over this. For those large group practices, or even if you're bringing on your first associate, but even for you as a provider, anyone that's a new dentist in my practice, when I bring on a new associate, we do these time studies, because the question is a 40-minute appointment really a 40-minute appointment? You don't know how long each one of those practitioners take. You don't know how long each one of your clinical assistants take. If Sheila comes in my office as a new hygienist, even if she has lots of experience, I don't know how long she needs to do an appropriate job for each appointment. So we do these time studies, and you can take a screen printer if you want, you can email me and I'll happy to send this to you. But we do these time studies for everyone. And then we know exactly that exact practitioner, that hygienist, that dentist, that assistant, how long does it take them to do that procedure? And that's start to finish, setup room and cleanup room. I will tell you, this can increase your production by thousands of dollars a day. And as importantly, you may have appointments that are too short, and you may be stressing your staffs out because you don't have enough time. So I mentioned I bring a lot of technology in my practice only if it increases my clinical acuity, the way I can communicate, the ease it is for patients and for parents to understand. So number one, I've been a client with Pearl for 2.5 years, I think now. Even before integration to EagleSoft was a thing, I use this on a daily basis for every single patient. One quick story was back in December when EagleSoft was doing an update. I needed to do an update with all our computers. And so Pearl wasn't running at that time. And I just didn't find time to do the update as we all get busy. And I went a couple weeks without Pearl, and it was pandemonium in my head because I promise you, I'm not making this story up. I lost that ability to show a parent this, right? I wish to go back to my days with the light box of holding things up. Mom, do you see this? No, they didn't see that, right? I lost the ability for that teenager to look at this image and understand I'm not making this stuff up, right? When you're eating Cheetos at 11 o'clock at night and Takis, and then you've got all these holes in your teeth, buddy. Number one, you've got holes in your teeth. They're going to be there forever. Number two, your parents have to pay for these things and you have to go through treatment. So how do we improve so we don't have to fix teeth? That, to me, can only really be effectively communicated when you have an image like this. And so this is Cavo's device. This is DiagnoCam. This is one of my favorite things to talk about and use. This is intraoral camera transillumination and fluorescence for diagnostics. And then I've integrated intraoral scanning in my practice. So this is Panda Smart Scanner, very fast, super small. It's like the size of a curing light. These three tools, these three pieces of equipment allow me to have the most accurate and clinically relevant diagnosis possible. So if I do all these three things, and I know all three things for everybody gets Pearl and gets radiographs, right? But if I can do all of these three things, I have the most complete documentation possible. So let's talk about AI and how we integrate that into our practice. Everything is AI now, right? I went to the hardware store and there was refrigerators for sale. It's something AI integrate, like, I don't know if your refrigerator really has AI, but they're calling it AI, right? So what we're going to focus on today is really this diagnostic assistance. I like the term automated interpretation. That's what it's doing. I need everyone to remember that the AI is not taking over your job. It is not going to diagnose and make the final diagnosis for you. It is helping you to not miss carries. It's helping you to communicate. It's helping your team. It's not going to tell you to do an MO on number 3. That's what you went to dental school for. That's what you went to hygiene school for. It is helping you with that diagnosis, but it's not making a decision for you. Pearl does a lot of other things with scheduling, insurance verification, and what I have just integrated, which I am super, super excited about. I haven't even had it long enough to talk about it fully in a webinar like this, is Pearl Voice. Just last week, I had a long consultation with a parent, 15 minutes. They had a lot of medical history, and there was, child had a lot of stuff going on. There was stuff going on at home. Child needed, 16 out of 20 teeth restored. We had to do general anesthesia in office. So that's a 15, 20-minute conversation, correct? I timed myself, and it was a 14-minute note after when that parent left, because we all know if you didn't enter it in the notes, it didn't happen. Right? I could have talked about something for 20 minutes, but if it's not in the note, 6 months from now, it never occurred. So what I'm excited about is now having the ability, I took my little mic off, is having my little mic on my, I got one right here, and having my little mic on, and boom, I take this on. It goes, as soon as I go in the treatment room, I click Pearl Voice, and it is going to dictate as I'm talking to the parent and the parent's responses to me. And that 20 or 16 minutes, however long it took me to do that note, 13 minutes, that's done, right? And it's done and it's completely accurate with that exact, with that transcription, right? Both my conversation and with the parents. Medical legally, I cannot stress that enough why that is so important, right? Because not only, before when I was doing notes, it was, well, parents said this, blah, blah, blah. Well, question is, did the parent really say that or did I just put that in my notes? Well, it's now on AI. So I'm not going to go into a ton of detail here, but I really encourage, this is the way of the future. Even if you don't want to do this or not, it's going to happen at some time. I go to my doctor and they either have a medical scribe or they have AI doing it for you and for them. And this is just part of what the world is going to be in the future. So let's really talk about second opinion. So second opinion is really that. It's a second opinion on looking at the diagnosis for radiographic and evident caries. So what does it do for us? I 100% believe that I am more accurate with Pearl than without Pearl. I know for a fact I am. I've been doing this for 23 years. I think I have a good idea of how to read x-rays. You know, I started with digital radiography a long time ago with Schick. I got on a bunny suit in New York and watched them build my sensors. I've been around this for a long time, but we all miss things. I don't care how good you are. And you can miss things because of the quality of the radiograph. You can miss things because you're just going fast or you just didn't see it, right? And I don't want to perform supervised neglect. That word is so appropriate and it just kills me because it happens, right? Are we going to watch? Or am I going to miss something? That's supervised neglect. That patient, that parent is putting that child in your hands and they're saying, please check my baby. And if you're not accurate, not so great. So I want to lower the chances of me missing things. I want to improve my communication. I want to have a high acceptance rate for treatment, and I want to build trust. If I build trust at first, and I mentioned this, that second, third, fourth appointment, parents tell me all the time, no, don't worry about it. I understand they need work done. Great, no problem. I also find this is an issue too. In my area, I'm in a community, I'm really close to Silicon Valley, and I have all these families coming in from all over the world, people that are 10 times smarter than I am, engineers, and, they can probably program AI, stuff like this themselves. But a lot of those parents also did not have early dental care early on because where they grew up, they mostly went to the dentist when they had pain. Not everybody, but a lot of parents have done that. And what this allows me to do is truly have that second opinion. I'm not making this up. This is really what's going on with your child. And let me have the computer show you, right? So these are all of, or just some of the features that Pearl AI detection will help us with. So enamel lesions and carious lesions, calculus knowable margins, periapical radiolucencies, bone level, not apropos so much in a pediatric practice, but I don't care who you are and how good you are not going to be able to see all these things all the time with every single one of your x-rays without fail, right? I have all of this built in and it comes up like that with an EagleSoft. So here's an example of EagleSoft. I just randomly grabbed a patient. And so you can see they've had all these x-rays over time. This is integrated into my EagleSoft imaging. So there's the x-ray and I can turn on caries yes, caries no. I can turn on the tooth parts. I can turn on bone heights. I can put on knowable margins, right? I can show where the fillings are. It's integrated and it comes up right away. And I need to have this gets into that speed or efficiency. So are the computers going to take over the world? I kind of thought that a little bit on AI. Sometimes I do think that, over time, but please, I'm joking. I see this, I can't even tell you, I've told Sheila this before, I get so frustrated because I've seen this quote on so many Facebook groups and I want to write back and sometimes I just let it go. I've been a dentist for X amount of years. I don't need a computer to find cavities for me. Well, sir, ma'am, you miss stuff, okay? Our eye can only detect, about 30 to maybe 60 shades of gray at the most. And if I'm at the paint store with my wife, I can only see 2 and she can see 100, but hypothetically. But the computer is the AI, it is machine learning looking for patterns. It's looking for these shades of gray. I can see maybe 30 to 60 of them. And as I'm getting older, maybe it's only 30 or 20 of them. But the computer is going to see thousands of gradations of gray. And that's what it's picking up. It's not taking over your jobs. There has been multiple studies both done within Pearl and outside looking at clinical accuracy and repeatability. So it's not just one time sitting down with a set of bite wings and looking through. If I gave all of us that are clinicians on here an hour to look through a set of bite wings, we're probably going to diagnose pretty correctly. Now, do that 5 times, do that 10 times, 20 times, 30 times, 40 times, 50 times. Sometimes we'll see spring break, we may see 60, 70 patients in my practice, right? Not by myself, right? With associates. But that is a lot of patients to come through. And I don't want anything missed for any single one of them. And if you think as a practitioner that you are going to be 100% accurate all the time, call me. And we'll sit down, we'll do one of these studies because we all miss things. Now, you're not going to necessarily miss large carious lesions. You're going to miss what I call we call this the opportunity for minimally invasive dentistry. It's the small therapeutic window that we have. And this is more apropos than ever now that we have things like Curodont, now we have things like SDF, we have fluoride varnishes. It's that chemotherapeutic window that's very small. If you diagnose early, you may not be telling that patient, well, you need a restoration, but I may be able to put SDF in your teeth and just paint something on and never drill a hole in your tooth. That's what I want people to understand is big holes in teeth. Yes, you're going to find them. But if we're looking for more incipient types of decay, that gets missed. And you also have to base your examination on junk in, junk out. If you don't have, this is a light bite wing, Sheila, would you say, that's probably a little bit underexposed, but am I going to now ask my team member to resnap that x-ray? And it's always going to be on that patient or that parent that doesn't want x-rays, right? Those are always the ones that are going to be like overlapped and underexposed. So let's look at this clinically and say, well, I see some things here. I see some things here, right? Where's the decay here? Well, that's the Pearl diagnosis, right? Incipient decay and then decay into the dentin. And not only is it showing me the areas of where the decay is, it is now a legal medical record on looking at progression of decay over time. It doesn't pop up here, but I'll show you in another slide. It will say, what is your percentage of decalcification or decay or that E1, E2 in the enamel and where is in the dentin? That is exponentially important now that we have more of these chemotherapeutics, right? The SDFs, the Curodonts, the varnishes, right? And even for bone loss, right, Sheila, if you're putting antibiotics in that area, it's one thing to put your probe down there, right? And I'm sure everyone's super accurate with their probes, their angulation may be off, but if you take it the same angulation of that PA or that bite wing every single time, now you have a medical record of that bone loss, right? Down to the millimeter, 10th of the millimeter, I should say, right? I don't know if everybody's going to pick up 7 lesions from there, and I don't blame them. This is not an easy to read x-ray, but machine learning is going to pick that up. It's going to pick that up, right? And now we have this, parts of the tooth. I'm no longer, I don't remember the last time I grabbed a piece of paper and a pen and draw like little tooth parts. I'm sure many of us have done that. But parents, patients, grandparents, whomever's there, they need to understand, because if they understand, they can tell the difference between colors. They can see this is white and this one's probably worse than over here, right? And now I have the ability to say, well, these, I never say, you have, I try not to say watches. I say, there are cavities, but thankfully we've caught these before they progress where I have to restore them. So these may be great teeth for chemotherapeutics and increasing home care and getting, your Previdence out, having them come back for SDF or all these other, topical solutions. But now not only do I have the ability to diagnose, but I have a medical record of progression over time. And that's essential. The more of these chemotherapeutics we're putting on teeth, because I need to be able to track. I don't trust my eye from 6 months ago to today, but I can really tell is that getting a little bigger or not. The AI is going to pick that up and it's going to give me an accurate measurement. So, doctor, when you say you can tell cavities between teeth with the naked eye, fine. Yes. Can you measure? Can you tell me from appointment to appointment what percentage is in the dentin and what percentage is in the enamel? If you can do that, shouldn't be in dentistry and you should be, an engineer and figuring these things out yourself. All right. What's more important, or actually as important as a clinician, I can diagnose a bunch of things and I can take my standard x-ray on my light box and I can be sure in my head, Well, there's 3 watches and 4 teeth to do. Okay. That's one thing. But if the patient or parent doesn't buy into how important these are to either monitor or increase hygiene or to restore, or now you need a +2 restoration or a root canal or whatever it is, that's only half the puzzle, right? I can diagnose all day, but if I don't have people coming back for treatment, all I did was tell them you had problems, good luck to you. The circular loop is, what's your problem? What's your solution? I always need my patients to be, and I don't want them going forward. If I can do that going backwards, is now here's your problem. Well, we picked up these things early, and now we can increase home care. You may come in for more frequent cleanings. You may need more scaling root planing. You may need now SDF in areas. Hopefully that circle's going backwards. I can't think of a better way of explaining this to a parent or a patient, seeing this. I mean, to me, this is why I talked to Sheila about this last week. I just don't know why people don't jump into having tools like this. And maybe they just don't know. And that's why I'm so passionate about talking about these things. Because let me tell you, that 3 weeks or so where I didn't have Pearl, it was a whole lot more difficult trying to explain things. And what's the other thing I can do with this? I'll show you a slide here in a little bit, but I am able to now take that Pearl image and in one click of a button, PDF, now I can send it to that other, the other parent, or maybe it's a divorce situation. I use this a lot. It goes, one parent shows up and they don't talk. Well, I can at least send that Pearl image to that other parent, and there it is. I don't think there's a better way to diagnose and to communicate than this. I really don't. I really don't. So again, another example. How many areas of decay do we see? Well, yes, is it there? You may be able to see it as a clinician. Do I want to show that to a parent or a patient and try to convince them that they truly have caries in their teeth? What do you want to work from? Do you want to work from that, or do you want to work from that? You pick. I think the answer is obvious there, right? These before and afters are just amazing, because I think about, for the last 20 years, I was working from this, and I know that my treatment acceptance rate was not as good because I can track that, right? I have lots of tools and metrics to track. So this whole idea of having tools for this case presentation and building trust is equally important. I used to use this slide a lot, almost for everyone. I would show them, okay, here's what a cavity looks like in the x-ray, and then here's what decay looks like on the same 2 teeth. And I'd go in this whole diatribe, and this is how I was discussing treatment with parents, because I wanted them to believe me. And this actually worked pretty well, but it takes a whole lot of time to talk about. And it doesn't show on their child or their teenager where decay is, because we know sometimes you can see things radiographically, and your brain is calibrated as a practitioner of how big that lesion is. But look at that difference, right? Now, if I had a tool early on, or technology, to even pick these things up earlier and not let that lesion be cavitated and just do a surface chemotherapeutic treatment, things are great, right? I passed that chemotherapeutic window. There's a hole in that tooth. I don't care how much topicals and things you put in there, it's probably not going to get that much better when it's already close to the dentin. But I missed that window, right? I want these tools early on. And again, I want you to remember, it's diagnosis and it's communication to have that patient come back. I want you to be able to close that loop. This is a pediatric webinar, so I want to just show some examples of what caries looks like, right? How much easier is to explain to a parent why they need to floss. And well, we may do some SDF on here. Maybe eye needs a class 2, but I'm able, I think even with someone being a layperson, they can look at this and see where the cavities are between their teeth, versus if I have the standard x-ray, it's just not as easy. And this is super cute. I'm glad that Pearl came out with this. These are sugar bugs. So you can click a button. You can't do this on integration with EagleSoft. So this would be something you pull up in Pearl running online, but it shows little sugar buggies between the teeth, and it's very cute to do with your patients, right? And there's the little sugar bugs. So they did a nice job with this, and I do use this because I think, if I want to talk to a 5-year-old who's fighting their parents about not letting them floss and running down the hallway at nighttime, they're not going to look at colors on the screen. Now, are they going to look at little sugar bugs? Absolutely. I have many parents that have told me, that I don't know what you did to talk to my child, but now they're concerned about these sugar bugs. I had I wish I kept it. I had one child who came in with a picture of the little sugar bug and handed it to me, right? I mean, that's adorable. But what that means is they listened, right? That 5-year-old who was probably running around the operatory not paying attention, when I showed them sugar bugs on screen, oh, they listen, and now they understand why they need to have their parents help them floss at nighttime, right? So there's your case presentation with sugar bugs. I think it's adorable. Let's talk about acceptance rate, right? It's that circular loop. It's diagnosis and then acceptance rate. And this is a slide from Pearl. So this study they looked at, I think this was a Gallup poll, right? 64% say they didn't understand their x-rays. I think that's probably high, right? And we see, 40% say they distrust dentists. That number used to not be that low, I'm sure, right? I mean, dentistry has always been, at least what I've heard, is kind of up there and, with patients believing their dentist. And I think some of that's been eroded over time. I don't know why, but it definitely has. I want to show you, and this isn't a show-off slide, but I want to show you what my treatment acceptance rate is in my practice, right? We have a very high treatment acceptance rate. And, that's a whole lot of patients seen. And so it says 32% of them had needed some diagnosis for treatment. And I believe this comes from a couple things. It is leveraging technology, and it is increasing my ability to communicate, both having technology on the screen and as a practitioner. So one of the things that I talk about when I lecture specifically on treatment planning and communication with parents is stopping, right? Let's not just let the technology do the job. Change your body posture. Make sure that there's no distractions. If you're busy, that's when I slow down. That's when I put everything down and I stop and I concentrate and I make eye contact. And I want that parent to understand they're the only child in the entire world, including my children, that I'm thinking about right then. And you can do that. You can have those communication methods and understand body posture. But again, if they're looking at little, grayscale on a tiny screen, you just don't have that ability. And as dentistry's getting more and more competitive, it's hard to get patients in the door. I need to have a high acceptance rate because I want my kids getting treatment. I want my teens getting treatment, and I want them coming back. And also at the end of that, realize that money that they paid is worthwhile, right? Is worthwhile. So it's a bunch of things. It's not just cavity yes, cavity no. It's, are we going to do something about it? And once it's done, do they see the benefit of that in the long term? One quick pearl here is I stopped using the term baby teeth a while ago when I'm discussing treatment with parents. And the reason being is if you were to poll all the parents in your practice, or if you just called all your friends and you said, when do baby teeth fall out? Most of them are going to tell you 6 to 7 years of age, right? Because they remember losing incisors. So the lexicon, the term I like to use more is primary molar exfoliating at 10 or 11, or primary molar exfoliating at 12. Because if I tell that parent with a 3-year-old, you have cavities in your baby teeth, even if they see my Pearl AI image sitting in EagleSoft, they may go home and tell that other parent, well, they've got cavities in their baby teeth, but they're going to fall out soon, right? No, they have cavities that are in the baby teeth that are going to fall out at 10 or at 12. And here is the PDF of where all those lesions are. And it's not me printing out that bite wing I used to here and scribbling notes on it. Here's the Pearl diagnosis, and we can email it. It sits in the chart. Medical legally, I'm covered because I have done everything I can humanly possible. I have my scan, I have my transillumination, I have my fluorescence, I grab my pen, I'm doing an intraoral scan, I've got my Pearl. To today's technology, I do not think there's anything else I can integrate to have a more accurate diagnosis and communication ability to my parents. So do we want to diagnose from this, or do I want to diagnose from that, right? That answers itself, right? Yes, everyone can see this, but does that need to be treated or not? Well, what about here? What about here? We know that radiographs occlusally are not always so great, but you can see the stuff, and it's that accurate. And this is not a very good, the exposure is not perfect on this, right? It's a little underexposed in my eye, but look at that, right? That speaks for itself. And that's why I love talking about this, because even if I just sat here and just showed you image examples, you're going to see that this works so well. And it just changes your ability to have to convince someone. And then I can spend more time talking about the actual treatment. So let's talk workflow. And I alluded this a little bit earlier, is that it is not just a workflow for the doctors. It makes everybody's life easier. My parents come up front. They know needs to be done. Yep, I saw the little pink and I saw the little yellow. My assistants have already gone over things. And this is the kind of, this is the flow in my office. So as soon as that bite wing comes up in EagleSoft, my team sees all the coloration, and then what do? So here we go. Yellow and pink, stop and think. That's what we talk about. I want my team members, if we're seeing 70 patients that day, I need my team members to have an actionable plan once the Pearl image comes up. Does it mean they're not diagnosing, right? They're not saying, okay, we're going to do all these, we're going to restore all these teeth. What are they doing? They're going to write down all the areas of concern. And if I mark those as watches, what they've already done is they've said, oh, Dr. Josh, I saw the watches in Pearl. They all look the same as they did 6 months ago, right? Because it takes me time to look at the current film and look at the tooth chart and decide if there's any new watches. They can count, they can look at the chart, they know the tooth numbers and letters. They can be my second or my first pair of eyes actually on that image. So yellow and pink, stop and think. Do I continue with the cleaning, right? I don't want them spending a half an hour cleaning teeth that have a bunch of holes in them. So they may decide, you know what? I see a lot of yellow and pink. My rule is usually 3 or more. If they see a lot of yellow and pink, it's time to get a doctor and not spend a half an hour cleaning teeth when we could be talking about treatment planning. Do I need to get disclosing solution out? Do I need to go over flossing? The answer is yes for all those things. Do I get that doctor back right away? The way that we schedule is I don't want them, they can easily do that cleaning at the time of treatment, right? I'd rather spend the time diagnosing and trying to head off that problem before it happens in the future. Do I need to bring the parent back? Yes. Do I get disclosing solution out? Do I, am I late for my next patient? Because if they see lots of yellow and pink, they may know intuitively, I'm going to be here for a while. So they're now buzzing the treatment communicator for that day. And they're saying, hey, Shelby, I'm probably going to run behind. I need someone else to get my patient. But they're doing that at the start of the appointment, not when there's 4 minutes left and they're already running behind and we haven't prepared for it. And do I need to tell other people at the team, hey, front desk, we're running patient has a lot going on. We're going to be running a little bit behind. I know the parent is in the waiting room. Will you please tell them it's going to be another 10 minutes, right? And then we let the parent know so they're not just sitting there and wondering where their child is. I mentioned this earlier, but we use this a lot. This is a PDF that we can, and this is going to be from Pearl Online, Second Opinion Online, and we can click a button and download that PDF. And so that parent that's not there, if that team comes by themselves, that patient gets a report card, or to another parent, or just for documentation for claim submittal purposes. It is not going to get any more accurate than this. And if the insurance companies are fighting me on this, I don't even know what to do because I don't know what else I could do to tell them that treatment is required. But this is as much information as possible with today's technology. It's all right there and it's trackable over time. Wisdom teeth, I know that, this is something we talk about a lot in pediatrics. Parents can see these things very easily. And pretty soon, I think sometime this year, I'm going to be integrating CBCT. To be frank, I only know a little bit how to read these just from having an orthodontist that has a CBCT. And unless you look at CBCTs all day, I don't want to miss anything there. Pathology, God forbid, right? We're doing bigger scans in the area that we really need. And having all this in my back pocket I'm super excited. Not about buying a CBCT, but having a tool to help me diagnose and read. All right. So just last couple things from me, shameless plug. So this is my training center. If you want to come see me, I talk about Pearl and AI in every single one of my courses because it's integral in diagnosis and treatment planning. So if you go to pediatricdds.com, you'll see all of my courses. And then for the first time this year, we have an orthopedo course together that's going to be in South Carolina. So I'm reachable. We teach a lot of this, treatment planning and really aesthetic dentistry in the anterior posterior that I've never seen anybody else teach. And again, there's my contact information. So Joshua at pediatricdds.com or pediatricdds.com on the web. And I'm happy to answer any questions we have today. And we did great on time. And I'm going to turn things over to Sheila and Aaron.
Awesome.
Good job staying on time.
Yes, great job. This was amazing. So much information in there. So let me just share my screen again, and then
Do you
we
want me to
will
hit stop
hop
share on my
over.
end?
Okay,
You got it.
we'll
Oh, good.
hop over to the questions. There have been a couple
Sure.
that have come in. And just a reminder, if anybody else has questions, that little Q&A text chat bot at the bottom, you can type your questions in and we'll go through those here. So there was a comment that they loved your, direction to the team of yellow and pink, stop and think. That was a great idea. So thanks for sharing that.
Thank you.
Another question was, does the patient printout include the IO photos?
So we know the one that we give, I believe we send 2 of them IO photos. Sheila, you're shaking your head. Does it?
Yeah,
It
we
depends on.
just put that in. So you can
Oh,
select.
really?
Yes.
I learned something new. I'm so glad that I did. That must be new.
New. So we're
See, this is what happens when you work with an AI company is every day there's something new that comes out.
Yeah, it's important for the patient. And to your point.
That's great.
Mhm.
That is great.
Another question, what version of EagleSoft do you have with the integration?
That is a good question. So we upgraded to the most current, and you'll probably know the number better than I do. It's 25.
25.
Yeah. And, I will tell you that I think when we went from 4 to 20, 24, 25 is a much bigger step. A lot of the imaging software and drivers and things in the background needed to be upgraded. And that wasn't a Pearl thing. That was just, I think, with a lot of sensors and things we had. But the most current update took us no time at all. So that is, I'm always worried about, doing upgrades. And especially now we've had this whole thing with Windows 10 and Windows 11. But this one was seamless.
Awesome. Another question was, what type of consent is recommended when using Pearl Voice?
Sheila, you are going to be able to answer that better than I am.
Yeah, great question. So typically we will have this already embedded inside of our forms now. Even our new patient forms have, because we're recording most of our patients when we're answering phones. So you can add the consent right now when you start recording, Bob, do I have your permission to record? You can record it right in there. Or you can update your new patient forms if you don't have a current phone system where you are recording with patients. But that's a great question.
I just made myself a note. Yeah. What I'm doing now is I know when I pick up my mic that's when and I don't know if that's what's recommended, but I know then to ask at that point.
Yep.
And then Sheila, another question for you. Does this
Here's
Pearl
my mic.
integration work with Dentrix?
Yes, so we do work directly with Dentrix, and we also have a nice little widget that'll sit there and allow you to open up your patient directly. So we understand our clients, right? We're all living in this crazy busy workflow where 1 minute can make up a difference times 8 patients an hour or 8 patients a day, regardless of your capacity. So lots of ways for us to streamline your efficiency. And the other silver lining I wanted to bring up as far as buying back your time, when we are using AI images in the operatory, and I don't know how you feel, Dr. Solomon, but when I was explaining a lot about perio or cavities, when the doctor walks out of the room, I kept over explaining until I started using AI.
Correct.
Now I can show something. I'm not talking about shades of gray. I'm talking about pink and yellow. And that allowed me to stop talking and allow the patients to actually ask the questions they needed so they could actually move to getting their treatment scheduled. So that's been a huge silver lining with using those tooth parts in the operatory.
Correct. The way I've described this before is it's like, having them understand the x-rays. I want it to be a light switch. I just wanted to come on. I touch a button. I know it works. We need to get through the light coming on. And then I got other things I need to talk. Like I need to go in the room and go to sleep, right? I want to be able to just click that light switch up. My goal is to go to sleep. It's not spend a lot of time figuring out how to do the light switch. So I want to spend the time discussing, is this going to be a composite? Is this needs to be a full coverage crown? What behavior do we expect out of your child? Are we going to use nitrous oxide? Are we going to use sedation? So I I would love for the decision of what we need to do to be just done and over with, and then I can talk about how we're going to do things, right? And I just found it next to me. So that's the little microphone. It is literally a little tiny magnetic clip. I ordered it from Amazon at 8 o'clock in the morning, and it showed at my house. A little creepy, but like by, I don't know, 11, and there they are. And this is the mics that we use, little tiny, and these were inexpensive. I think $30 or so, $40. Comes with two of them, and that's the little thing. So when I clip this on, then I know to ask for permission for voice. I'm going to put it on right now. Here we go.
We're being recorded, Aaron.
I didn't ask your consent, so no, you're not.
Yeah. All right. Well, that looks like all of our questions, and we're just about at time. So I guess I'll leave it open to you, Dr. Solomon and Sheila. Is there anything else that you'd like to share before we close out today?
I do. I always have stuff to share, but I think the important thing is for people to understand, one of the things I like about Pearl is there's no contract in any stuff. And I don't get paid to tell you this, but I would say just try it, right? Just try it. It pays for itself, in my opinion, in the first day. And if you somehow don't want to use it or don't like it, then cancel it. But there's no contract. Sign up for a month. It's very easy to get it up and running. And if you find you don't like it or you don't use it, I haven't met a doctor yet who's told me that, but there's no long commitment, because I cannot stand in dentistry where you get signed up for things that are expensive. Even things are not expensive, but things are, very expensive. They want a year commitment out of here. And I find in my hands, it literally pays for itself in the first day of that month.
Excellent.
Amazing.
Well, we are so thankful to have you, Dr. Solomon. It's really a huge win when we can see how we can use all these technologies to spend less time on mundane tasks and more time building relationships. So
Correct.
Really thankful to you for sharing all your knowledge with us today. Like I always say, we're going to see you back soon. But and to the Patterson and EagleSoft team, really thankful for our partnership, and look out for some more webinars. And we'll see you all soon. Have a great week.
Yes,
Thanks so much, everybody. Take care.
We love bringing these tools to our EagleSoft customers to make everything run more efficiently, and to build that patient trust. So thank you, everybody, and enjoy the rest of your day.
Thanks so much.